This is how you can avoid costly dental treatments by looking after your teeth properly. I feel like the point is horrible. And is it horrible? Hi, I'm Louise. I'm the hygienist here in 3Dental on Aungier Street. So here I am today talking to you about how to actually properly brush your teeth. So what I would normally go for is a soft manual toothbrush. Anything that's a medium or hard bristle brush is way too harsh to the tooth and the gum. You can end up causing yourself some tooth and gum damage, which then can then recede back to the gums and cause sensitivity. What I like to use is either a Curepox Ultra Soft toothbrush or a small compacted head, like a TP Compact is really good as well. What we want to do is when we're brushing your teeth is to focus where the tooth meets the gum. This is the most important part to brush. Plaque builds up along the gum line, then extends down the tooth first. A lot of patients tend to scrub back and forth, which is something that we don't want to do. That scrubbing back and forth is like a saw hacking into a piece of wood, especially holding like a death grip, can actually cause the gum damage. We want to be careful with our gums because they're nice and soft. In around each neck of a tooth, there's a small flap of gum that doesn't fully stick to the tooth. Bacteria like to hide underneath the gum line, and then that's when you get gum inflammation and gum bleeding problems happening. The way that I like to recommend patients brush their teeth is to hold it like a pen. So you're easing up the pressure and the grip. Where the tooth meets the gum, again, is the most important part. We want to place half the bristles on the tooth, half on the gum, then tuck slightly up 45 degrees in towards the gum line. I normally recommend to use your elbow to draw tiny circles, so you're gently massaging the bristles into the gums. If you use your hand, you can end up causing pinch force and moving the bristles away from the gum line from where we want them to be. Same thing on the bottom, half of the tooth, half of the gum, tuck it down, and again using your elbow to draw tiny circles. Ideally, you want to spend about 5 to 10 seconds per tooth before you move along to the next one. Now, inside surfaces tuck down and tuck up into the gum line. But when you get the premolar tooth to premolar tooth top and bottom, because it's coming to the arch of the mouth here, if you're trying to brush in horizontally, you're going to be missing some areas. What I recommend is by opening really wide, popping the brush in, and reefing the handle up to the nose. A lot of people's handles are down too low, where you can see it's not hitting the gums as well as what it should. So up to the nose, up and down motions in behind here. Same thing for the top teeth, you're bringing the handle all the way down towards the chin, going vertically behind your teeth and brushing up and down. Biting surface is something that people tend to miss, so because food and plaque gets trapped in between the biting surfaces, we need to really make sure we're brushing out there, or else we could develop tooth decay. So good circular scrubbing motion, you can do a couple of strokes in behind the last of your teeth and that will remove that there for you. Other one that we can also use is electric toothbrush. The one I like to use is an Oral-B, the one with a pressure sensor. If you don't have a pressure sensor, you can apply too much force and cause gum recession as well. The Oral-B toothbrushes do the work for you, okay? So you don't need to do any scrubbing motions or any circulars. What you want to do is place half the bristles on the tooth, half on the gum, tuck the bristles up in towards the gum line. The way I normally say is to rock the bristles from corner to corner. So you're contouring the bristles around each of the tooth surface. Same thing at the bottom, tucking down onto the gum line, tucking and rocking. Again, 5 seconds per tooth. If you see the red light pop up on your toothbrush, it means you're applying too much force and you need to ease up on the pressure there. Same thing for the inside surfaces then, tuck and rock. Same thing for the top, tuck and rock. Same thing again, handle up to the nose. Again, if it's too low, you're not hitting the gums, up to the nose and making sure you're rocking the bristles from corner to corner. And same thing for the top teeth down to the chin, rocking from corner to corner. Then your biting surfaces, you're just holding it for 5 seconds, letting the brush do the work for you. So that's everything that you need to know about brushing your teeth for today. See you soon.